Hello, good morning, everyone. Once again, I am back with one another video and a good update that one of the conference is going to be organized from NCDC, that is the National Center for Disease Control, and named as NPHICON 2024, National Public Health India Conference 2024. They have called for the abstract and that is directly based on oral and e-poster presentation will be over there. Abstract which has been previously published in any journal or presented at any conference will not be submitted. Sorry for this. And the scientific committee for this conference is directly reserving their rights for that all the submission which is going to be submitted for this NPH icon. So we need to prevent print or any electronic media. You can see that in the over here that one of the website from where I have taken this all the data, and I will also share that one of the official letter which has been arisen. Uh, like basically all the submission of the abstract has to be registered first for the conference. And a very good thing is that we are having a lot of time, like basically the 4th February. That is 4th, like basically it's not a very, I'm saying in that another way that it's we are having only for 10 days over here. So if anyone is going to submit, so you have to be active. So you can do it anything like basically by this weekend, Saturday to this Saturday and Sunday, so that we will have some of the time to prepare and submit this abstract, like basically which has been asked as per this given time frame, and the details in which abstract has been asked. I will share that as well. For the more likewise, I have covered that all the details over here, and if again you need to go through the website, so I will be sharing that link into the description box, as well as registration for this also I will be sharing in the description box. Health initiative towards India's goal for a development nation. So NPHICON foster a great learning platform, and objective for this conference is that enable sharing of experience and best practices on public health concerns. The 6 themes has been given under this. We will discuss that as well, on which we can plan and on which we can submit our research papers. I think a lot of us is working in the same region. One of the major part is tuberculosis. A lot of friends associated with me is on the tuberculosis only. Apart from this, one of my senior has been selected in AMR, so AMR is also one of the major reason for there. I will share that as well. So audience health and allied professional nationwide, and a focus like this insight from health policy maker implementation, like this whenever we are going to do any of the research paper or any of the program which we are working on, which we implementing. That is directly in the last part. You are when you are going to submit to the any of the ministries or the final conclusion of your implemented project, then directly it is going to be under the policies. What we are going to change that, so that will come in the focus area. So learning focuses disease eliminations effort, lesson from public health professionals. What we have learned, and that all the part will be going to cover over here. Research integrity and ethics essentials during humanitarian emergencies for evidence-based health policy. Like with data which is directly showing that evidence to make a changes in our health policies, that is welcomed. International health regulations, managing cross-border disease transmission in a globalized world. Likewise, we know that yellow fever, that if anyone is going to travel, taking the international travels, then you have to take that as well. So apart from this, likewise, most recent one, that COVID travel restriction over there, so that is coming on the international health regulation. Apart from this, a lot of will come over here. bridging gap, barrier and opportunity, medical curriculum for effective implementation of policies over here. So, abstract submission guidelines, they have given topic listed in the sub-themes, and sub-theme is a recent public health innovation in India. In this, the most recent innovation which has been came occurred like basically Ayushman Bharat. The sub-theme has been given Ayushman Bharat, tuberculosis, non-communicable diseases, as well as aspirational blocks. Likewise we are knowing about Niti as well as Piramal. Apart from this, some of the agencies working directly in the aspirational blocks, which has been given by assigned by the Niti Aayog. So how we have changed, how the program is affecting, what is the changes over there, how we are rectifying that all the bottlenecks, so that will come over here. Advanced tools and technology for public health surveillance and response. So, and the very recent, I will like to say that ki COVID, that the website from where we are getting that daily COVID updates, vaccination, immunization. Apart from this, if you will go through a HMIS tool that is covering likewise complete for our India. Apart from this, specific for Uttar Pradesh, there is UPHMIS dashboard is over there. So if any advanced tool and technology like basically informatics related or monitoring and evaluation parts which is going to directly affect on surveillance and responses, so that will be covered over here. Uh, in this, we can also take that key integrated health information platform, artificial intelligence, as well as environmental surveillance, and one is related to biomedical, that is genomic surveillance. And after this, that third one is going to the India toward disease elimination. In the third part, in this, zoonosis has been given, and the most important thing which is given over here is AMR, on which we can put our some of the parts. Environment is also there, climate changes, and likewise in the most recent G20, the climate change issue has been raised over there. So we can also have a look on this climate changes if anyone is working on there. The fourth one is coming for like this India toward disease elimination. In this, in what is given in this part, directly for vaccine preventable diseases, vector-borne diseases, neglected topic diseases, tropical diseases is over there. Research and ethics, that is machine learning. In this research integrity, we can take our ethics in research during humanitarian emergencies and disasters. The part will be taken over here. The third, likewise, the last one is coming for implementation of international health regulation in India. In this sub-theme has been given, sorry, in this sub-theme has given for global health security, all hazard capacity buildings, best practices, and point of entries. So these are the sub-themes has been given. So like basically the most in which I am interested, this is tuberculosis. Apart from this, a lot of people from our and working in the some of the organization that covering non-communicable diseases, that can be also a part of this. We can put our paper on this background. Apart from this, the most recent one, this AMR is getting a emerging, not an emerging, but getting a preference on the field. It's it is over there. Vaccine preventable disease also over there. VBD can we can connect on this. So official letter from DGHS been also has been came that there is of the same that announcement of this APHCON. So we can also refer to that while preparing our abstract submission and that all the procedures. So agenda for this has been also posted over on the website. First National Public Health Indian Conference NPHICON. Themes: Health Initiative toward Goal of India as a developed nation. So the session one will come over here on the very first day. A recent public health initiative in India. The themes will be covered: Ayushman Bharat and aspirational blocks, tuberculosis and non-communicable disease. A detailed discussion will be over here, and keynote address will be MD NHM, Ministry of Health and Family Welfare. Apart from this, four paper will be selected over here in this theme, and that will be going to be. The session 2 will be based on advanced tool and technology for public health surveillance and response, IHIP, that which we have covered, and artificial intelligence, environmental surveillance, genomic surveillance. So for this keynote address will be given by Joint Secretary eHealth and NCDC. Again, as in the session 1, 4 paper has been selected, and the same category will be over here. Fourth paper will be scientific paper will be selected, and that all will be the oral. And based on this, this will be end by discussion. On the same day, day 1, we will be having session 3, India toward One Health, Animal Husbandry, Wildlife, FSSAI, and that AMR, IMD, and NCDC. So, collaborative toward one health panel discussion will be over here. A panel, like we see, keynote invite is not here. So, panel discussion collaborative toward health will be done. And now this paper has been degraded from 4 to 3. 3 paper will be over here for oral. Now, day 1 will be closed on this, and day 2, session 1 will be directly on vaccine preventable diseases, specifically for polio, measles, mumps, and rubella rabies. Immunization division, VBD, NTD will be over here. So, invited presentation keynote address will be TBD, will be given from the TBD, and again that 4 paper will be selected, that sorry, all for the oral one, and based on this, after the end of this, we will be having one of the discussion. Session 2 for the day 2 will be research and ethics, machine learning, research integrity, ethics and research. So day likewise on the day 2, session 3 will be implementation of international health regulation in India, that will cover global health security, all hazard capacity building, best practices as POEs. So invited presentation likewise keynote address again from TBD. Day 3 session will be current curriculum in medical education to public health, implementation in India, barrier and opportunities. Panel discussion will be done, and from over here, state program officer of any one program will be called, medical colleges, a representative from community medicine department, PHFI, National Institute of Health and Family Welfare, DMCs, IHMR, chaired by NMC representative, and DGHS, that the same which later has came from, that is from DGHS. Based on this, the session will be closed. So by this I am preparing one of my part for tuberculosis, but I can say that when I was in year of 2000, not in 17, in 2018, I was looking for some of the seniors, and also I have contacted some of the seniors at that time who were working at the state. They are senior in my Master of Public Health, and for the guidance on writing the research paper and abstract, but I have not got any of the support from anyone. Uh, fortunately we can say, or unfortunately, but the thing is that ki, if you are waiting for someone who will come to make you learn and who will push or pull you for this to get this opportunity, so this will be not going to be happen if you are waiting for someone who will counsel you, who will help you for in all of this. So this position will not going to happen in your career. So you yourself has to be push yourself, either you are working or not working in the education. You have to extract out your valuable time from there and work on this. So for the same, there is a quote: goal is not to be a successful. Goal is not to be a successful. The goal is to be a valuable. Once we will be valuable, it will attract success itself. So based on sorry, based on sub themes. So some of the like basically in general topic I have created over here. For Ayushman Bharat, evaluating the impact of One Healthcare accessibility. This is a very general on this. So directly on Ayushman Bharat, you can track out this effectiveness. You can also track out that key benefits the population is getting. So any of the part in which if you are working in these areas, so if you have worked and taking the approval from your organization or your line chain manager, you can work on this topic and you can make it publish. You can submit over there. For tuberculosis, again general I have taken strategies and progress in TB control program. So if you are going to be deep down over here, so you can take any of the pediatric TB, uh, effect of MDRs, how we are going to work on this. Apart from this, that certification has been done in the last World TB Day in Varanasi. So you can take it out that after certification, what is the changes over there? A lot of things has to be done over there. We can work on that. Non-communicable diseases address the challenges and achievements. In general, I have taken. So directly for NCDs, NPCDCS program is running already in NHM. A lot of or stakeholders partners working on this. So if you are working in the any of organization, or if you are connected with non-communicable disease, or in the thesis of Master of Public Health, or even of your PhDs, if it is connecting with your topic, then you can submit on that. Aspirational block is already over there, as we have discussed for Piramal part, Mithi parts. So they are working, so we can take that as well. Advanced tool and technology, that is IHIP. So that is the same part which we have discussed on HMIS, UPHMIS. So that will come over here. Artificial intelligence, any AI, like basically nowadays by the use of artificial intelligence, we are tracking the chest x-rays in the case of tuberculosis. So use of AI in your field, if you are working in the cardiac department, so what is the effect of AI? So how it is assisting, how it's helping us to get the exact part of effect. So we can do a submit abstract on that as well. Environmental surveillance, genomic surveillance is over there. If it is coming in your part, then we can go on that. So One Health in India, that is directly connected with the zoonosis, AMR, environmental, climate change, and life. So AMR is like basically a very important part in this. So uh, so we can work on, if you are working directly on this part, so we can submit that AMR on the part of AMR as well. That its approach to save the lives of the populations in the effect of public health. Disease elimination effort, VPDs, vaccine preventable diseases. So progress and challenges in immunization, we can cover that part. Uh, Vector-borne diseases, strategies for control and eradication. NTDs, we can also take part on this. Machine learning and healthcare research. What is the application and implication we can take? research integrity to maintain that ethical standard in public health research. So on this behalf we can submit any of the abstract if we are based in any of the institutional or public health institutions. So we can submit ethics in research during emergencies, like basically ethics to follow in the public health research, like COVID has came. Apart from this, if any disaster is going to be over there, so in that part, what will be the ethics? How we are going to be tracking out these during the emergencies? We can cover that. IHR, in IHR Global Health Security, India's role in ensuring global health, how we are going to take a part on this as in the part of sustainable development goal. All hazard capacity building, preparedness of various health threats, uh, best practice at the point of ensuring safe cross borders and measures, how we are going to take parts and how we are going to manage these all. So I would like to say that we have to take some of the precautions and measures. So very frankly saying that if you are planning, so it is not possible that at a single click, at a single paper of submission, you are going to be your abstract is going to be accepted. As discussed in the agenda, you are able to see that in the session wise, only four paper is going to be accepted. But I would like to put it over here that we should submit over there. So at least if we are going to be rejected, then also it will not break our aims and objective and our motive. So we have to be show cautious and strong on this part, because a most recent example I would like to share that one of my research paper we have submitted in the month of in the last year, and that is in the uh, June 2023. Me along with one of the HOD, she is from very renowned public health institution from Mumbai. She is over there, and apart from this, one of his senior, he is internationally based. I am not able to take, it's not I am able to take, but it's not good in practice to take a name of your seniors over here. So he is also a part of that. Apart from this, one of my colleague from my last organization is also over here. But a good thing what I want to put it over here to make you motivate, that we have submitted in the last year of 2023, and I have received the first review part by the second week of this January 2024. So it will take a time that you have to uh, very cautious and like basically not too much in hurry. So you will it will take a time, good roads take a time to build up, huh? So on this background, I will say that we have to submit, but we have to cautious also. We have to we should have a patience as well for getting on this. If we are getting rejected, it doesn't matter that it will break your motivations for the papers and publication in the abstract. It builds a light, it adds a lot of stuff in your career, in your CV, and it gives a lot of skills as well, that how to write a introduction part, how to write abstract, how to write on methodology, how to take that data part, how to identify your population, how to calculate your sample size based on your various formulas, how to write a result part and data analysis, discussion, conclusion, and a very good thing is that a lot of once I completed Master of Public Health at that time as well. I was not knowing that a different type of referencing is over there. So it takes a time, it takes a patience, it takes a motivation. Based on this, I would like to say bye. We'll meet you soon in another video with a good level of knowledge and skill. Hope you will enjoy. Hope you have enjoyed. If it has added any of the part in your skill, and if it has motivated you to write an abstract over here and submit in IPHCON, so please do subscribe the channel. Thank you. Bye.